Firstly, I want to welcome you to EPAP Live webinar, series of our webinars launched several years ago. And this topic today will be EU project. So I'm really happy that we can speak about that. I'm Vlatka Matkovic. I'm a EU project manager at Lungs Europe. And today I will be hosting this webinar. So before maybe diving into our exciting topic of EU projects, how to get involved and how to benefit from EU projects, maybe just a few house rules so that we go through the webinar smoothly. So if you can, please do mute yourself so we don't have any kind of echoes and noise on the other side. There will be a time for a panel discussion, so questions and answers to all of our speakers. We are recording this meeting, and this will be later on available at the EPAP website and channels. You can have your cameras on or off as you wish. So this is something for you to decide, and do please use your chat function to update us or on any kind of your ideas, but as well questions for our speakers, and stay engaged. So we really do appreciate participation. So please feel free to put anything in a chat, and if you want a speaking slot, share something, then you can raise your hand and I will give you a time. So with that, let's just say a few words for those who are new that European Patient Ambassador Program, or EPAP, is free and online self-learning program that introduces patients and careers to some of the basic skills and knowledge needed to represent yourself and others successfully. So we have a number of modules in EPAP, and it's translated in many languages. You here have a list of our languages downstairs with the flags. So that's about EPAP. And today our topic is EU projects. So we really want to present EU funding streams, what exists in terms of EU projects that could be beneficial for patients, what role patients could play in those projects, and what usually role. So you get some examples from patients and patient organizations that previously have been involved or are currently involved in EU funded projects. And you will hear some advices for engagement, what exactly this means, and maybe some considerations before joining the project that you should have in mind. So today our speakers are really various. I'm really pleased to have Yasmin Zeifel. She's the European Patient Forum Project Coordinator. I will present her a little bit later, like the details about her. We have today as well with us Seamus Cotter from Ireland, Scott Vagers, Doblijon Karimov, Claire Williams, and Catherine Wiley. So those will be our panelists and speakers as well, and I will present later on each and every one of them. But now, actually, as a host, I will kind of hijack a bit of a space and present you Lungs Europe, because maybe you are not completely aware what Lungs Europe is. So on one side, we have a European Lung Foundation. You are well aware that this is a patient organization that brings evidence-based information and outreach to patients and public. On the other side, we have ERS, or European Respiratory Society, more of a professional network. And the new kind of entity is Lungs Europe, that came out as a child of ERS and ELF, and it's based in Brussels, this organization, and it's really working on EU advocacy and policy and engagement around European projects. both for professionals and for patients. So you can see it like these organizations working as a trio together. So in Lungs Europe, we currently have quite a bit of projects. I will not go into details of them, but you can see that they are spanning like from lung cancer screening, lung checks in schools, so looking at respiratory health of kids, in actions with the member states, medicines, treatments to prevent resistant bacteria and tuberculosis, tobacco, air pollution topic, palliative care topic, and as well some other very specific topics like pulmonary fibrosis. So with this, we came actually to EU financing for health. I call it for health, but it has many other kind of subjects, not just health. One key way to explore EU financing is through EU funding and tender portal. And I'm just showing a screen here how this looks like, where you can see all the calls for proposals, but also tenders, and you can as well work as a project for European Union and see some project results. So EU programs and funds really are spanning many of them. Here I just put several of those, and one is Horizon Europe, so Research and Innovation Fund that funds scientific and technological programs that can be in different kind of topics, you know, from environmental, social science, health science, and so on, but really focusing on research and innovation. While on the other side, we have EU for Health grants and funds that are basically coming from fund stream called Recovery and Resilience. And through this fund, we actually have access to some funds for health action. So really implementation of certain priorities that also EU looks in. Like, for example, reducing non-communicable diseases and so on. But there are other funds like European Social Fund and so on, which I will not focus on here. But of course, the list goes on, is really extensive. EU financing for health research. So there are several streams, as I mentioned, research and innovation. This is health research is really a key component there. So this is really quite funded a lot. The Horizon Europe is another one, a new one that will last until 2027. Then we will have another round of this research budget for to fund research in health and other kind of research. Then we have EU for Health programs, collaborative fundings like Innovative Medicine Initiative and other as well. So when we come to maybe your guide to EU grant application, what's really important is that this is kind of looked in all stages. So first it comes to grant exploration, or how actually do we discover these grant opportunities. So we need to read each and every one of them to see if we fit with our kind of activities and wishes to what we want to do in our project. Partnership is another key word. So really, all of the EU projects pretty much are in partnerships. So big, smaller or larger consortiums, except for some very different kind of funding stream, like operational grant that Lungs Europe just received this year. After that, you have to have this EU login. This is seems trivial, but it's not. Actually, you need to develop this kind of establish your digital identity. have a registration or organizational registration, and then only then you can come to this grant proposal submission. And I think later on, Catherine will tell you a little bit more about how demanding grant proposal submission is. So enhancing patient participation in EU health initiatives can be differently done through active patient engagement, but as well expanding roles, or growing number of projects are actually really looking at the patient contribution in those projects. And we have speakers who will really present some of their roles in the projects. So we go here beyond clinical trials and being engaged in the clinical trials, really be a partner in those EU projects, and together with scientists develop some of the methodologies as well, and contribute to the dissemination and communication and so on. So as you can see, diverse contribution is really a key. I will skim through this. So this is EU funding and tender portal, and the calls for proposal page looks like this, where you can kind of look at the program that you want to be financed under. For example, in this case, EU for Health. What exactly is the call and submission status? So is it open? Is it upcoming? And then you can select, you can see the topics, exact topics of each of the call. So for example, one of the call is call for proposals on EU network for youth cancer survivors, for example. So you can see more details about this specific call. Once you enter into specific call, then you see the opening day, deadlines, budget, what's the objective of the call, can you actually deliver on the objective, what EU is asking to be funded, and as well you can check the budget overview or how much money they're giving. And finally, how can we work together, like with you? So Lungs Europe definitely can help with the funding call identification to really discover what could be relevant and where to submit our proposal. We as well could do the project matchmaking in a sense, so assisting to see which exactly project could be ideal for you, maybe linking with the professional groups or other groups in other countries, how to bring up a consortium and connect people in between. We are also could offer a project coordination, so streamlined management of the projects from start to finish. And in the future as well, we want to take part as well in a proposal composition or crafting the proposal together with the partners. And actually with that, I would like to come to the end of this kind of introduction to EU project in a sense, and this would be also the opening space for all of our speakers. So as the first speaker, we have Yasemin Zeisel. She's a project coordinator at European Patient Forum. He coordinates EU projects on medical device innovation and clinical trials, as well as personalized prevention. And before joining EPF last year, she worked several years as a researcher on policy implementation, evaluation, and impact assessment projects and proposals for the EU institutions in Brussels. Her academic background is in international relations. So maybe Yasmin, you could tell us a little bit about European Patient Forum involvement in EU projects, and as well what what it means for patients to be engaged in EU projects.
Thank you very much, Vlatka, and also thanks for having me today. I'll share my slides if that's okay.
Mm-hmm. I stopped sharing, or I didn't. No, I didn't. All right.
All right. Can you see my screen?
We can, yes.
Perfect. So yes, my name is Yasemin, and I'll be speaking about patient involvement and engagement in EU projects today. And well, EPF is an umbrella patient organization focusing on chronic diseases, so we are not disease specific. And we have quite a long history of working in EU projects. I think the earliest were around 2008. And at the moment, we work on 12 different projects, but we have completed many others in the past. Before we jump right in, I wanted to give you an overview of how we approach patient engagement in projects. So we don't work as the projects team in a silo. We connect with other teams at EPF. And this figure you can see here on the slide is from our annual work program that you can also find on our website. And I want to direct your attention to the right-hand circle. So we work together with communications, policy and advocacy team, and capacity building teams to make the work as meaningful and relevant to latest policy trends, initiatives, and agendas that are out there. And today I want to specifically talk about two elements. One of them is creating platforms for and with patients, and some success stories we have there. And the second part is more on how we involve patients specifically in projects. So one success story that I want to start with in terms of creating a platform for patient engagement is the project Paradigm, which was launched in 2018 and lasted until 2020. So now it's complete. It was funded by the IMI, the Innovative Medicines Initiative. Now it's called IHI, Innovative Health Initiative. And the idea, as you can see on the slide here, Paradigm stands for Patients Active in Research and Dialogues for an Improved Generation of Medicines. And the idea here was back then to really bring patient engagement to research for medicines and make it happen for the first time. And we tried to involve or make patient engagement happen in early decisions on the research, in early dialogues. And one of the results and outputs that still exist today is PEOF. Some of you may be familiar with it. It's the Patient Engagement Open Forum, which was first launched in 2018. And it is a platform to discuss with different stakeholders, including not just patients themselves, but also patient organizations, patient advocates overall, as well as academia, industry, public institutions, topics that relate to patient engagement, and looking forward into the future, what can be done to make this a better environment. PEOF now has grown quite a lot since its beginning. Now we have every year many online sessions about different topics relating to patient engagement and recent initiatives, as well as an annual face-to-face event that is co-organized by PFMD, EUPATI, and EPF. And this year we had it in May in Italy, and I think we had over 200 participants and many sessions where we discussed topics such as digital developments, AI, inclusivity in clinical trials, and so on and so forth. So this is quite a success story for us. Another success example is the Patient Engagement Resource Center. This was born out of a project called EATRIS Plus, and it was done together with EATRIS, the European Infrastructure for Translational Medicine, as well as EATG, the European AIDS Treatment Group. And this project was finished last year. And one of the outcomes that exists today is this resource center to help connect researchers with patient engagement. So this platform gives them public resources to support their understanding of the basics of patient engagement and how it works through the different phases of patient engagement, and also give them some inspirational example videos, and also allow them to upload some resources that they may find relevant, so community contributions. And this platform was built together with patients, researchers, and funders. And in the first year after its launch, the platform had over 3,000 users. So for us, that was also quite a success. And you can access the platform at patientengagement.eu. It has quite a lot of interesting things to look at. So now moving on to more to involving patients specifically in projects and how we do it. So there is one way in which you could do it, which is short-term engagement through interviews or survey, but this is a one-off situation, and then there's no more engagement afterwards, perhaps. So to make patient involvement more meaningful and more structured in a project, we have been implementing patient advisory groups or patient advisory boards in the last few years. These are voluntary groups of patients, around 10 to maybe 20, but usually around 10 people. And they have different profiles. We try to often make a mixed group with different levels of health literacy among the group members, as well as age groups, genders, and different medical conditions. It really depends on the need of the project, how this group is composed. And the benefit of this patient advisory group being on the project is that throughout the project, we can engage this group and get their input. And this creates, as you can see in the figure, legitimacy, because we directly hear from patients their lived experiences. It also can address unmet needs by influencing research early on together with patients. It also helps foster co-creation, and co-creation together with patients can oftentimes also challenges researchers' assumptions in a project, so that's good. And it can create better design and outputs, such as methodologies that are being produced in a project, or templates or informed consent forms. There's many different outputs depending on the project, and these can be made better with these patient advisory groups. And finally, also visibility in terms of building awareness among partners that there are patients out there who can share their living experience and are willing to, and also create networks in that sense. And on the other hand, to bring in patients, have them participate in project events and meetings, learn about the environment, and also for themselves create networks. Another way of increasing visibility is also oftentimes we share the profiles of the patient advisory group members on the project website, so that it boosts a bit of the visibility. This is an overview of current and past projects where we are using patient advisory groups as a tool for patient engagement. As you can see here, one of the last projects is EATRIS Plus that I mentioned before, and currently we have 5 projects: IDERA, HEUEFS, Data Saves Lives, H2O, and Gravitate Health. You can find out more about these projects on our EPF website, but I'm also happy to try and answer your questions if you have any questions about a specific project. So I want to close with some recommendations about how to run a patient advisory group and how it works in general. So first, we need to determine the project needs. As I mentioned, every project is different, and the specific composition we want to go for. What kind of diseases are we looking at? And then we produce call documents for expressions of interest and review these expressions of interest or applications and decide on a composition. Then once we have the group, we ensure adequate onboarding by sharing information about the projects through information leaflets, regular meetings, or even trainings, especially when the topic of the project is very complex and needs some further boosting of knowledge. And also through setting up a compensation scheme. These engagements are very long, and of course this requires some time and effort from the patient advisory group. So we do compensate them for this effort. Yeah, so this is more the admin side of it. Then ensure good coordination and sharing of information within the project. It is important that we have a structured engagement on the one hand, because we need to know what is going on in the project and what the patient advisory group does in order to adequately compensate them, but also at the same time to create a safe environment, safe and cooperative environment where the patient advisory group can feel confident in sharing their views and experiences and thoughts with other project partners. And also, of course, to share information about updates and what is going on within the project at large, to not have this silo thinking. Another relatively new approach that we are using is to get patient engagement ambassadors. Ambassadors are usually partners in the project they can be patient organizations, but they don't have to be. They can also be researchers or from companies. And they're key figures who know specifically what is going on in the project in different activities that are being carried out. And they help us create accountability for the actions that are being taken by the patient advisory group, which means that if we as a patient organization together with the patient advisory group just work in our little bubble, the risk is that nobody else is interested in what we do. So we want to create these links to make a meaningful engagement happen. And together with these ambassadors, we set up patient engagement plans to outline what the advisory group should do, when and who is involved, to again create this accountability and meaningful engagement. And finally, keep the group or board engaged. As I said, projects can be very long, usually from 2 to 6 years. And so if nothing happens for a year, this is really tricky, because you lose members again, because this is a voluntary engagement. And so involving them in regular meetings, keeping them updated about what is going on in the project, and even doing satisfaction surveys. So constantly, but not overwhelmingly, keeping them posted and keeping them active in some activities that are being carried on is very important. So this is it from me for today. Thank you for your attention. And if you have any questions, I'm happy to answer.
Thank you very much, Yasmin. And that was actually a perfect introduction to our next speaker, Seamus Cotter, who will speak exactly what this means in practice, what you just said. Seamus is from Ireland, and he was diagnosed with stage 4 lung cancer in 2016 and participated on an immunotherapy clinical trial. In his advocacy work, he has been a patient reviewer for Irish organizations and is a member of a Cancer Trials Ireland Patient Consultant Committee. He is also the chairperson in the Irish Lung Cancer Community, which is a lung cancer patient support group. Seamus has been an invited speaker at 2 most recent World Conference lung cancer and also acts as a patient document reviewer for European Medical Agency. And lastly, but not least, Famous is also on the European Lung Foundation Lung Cancer Patient Advisory Group, which is the form, which is from where he is invited today to join us and speak a bit about his experience in Optima project. Seamus, the floor is yours.
Okay, thank you very much. So yeah, I'm a part of the Optima project, which is a collaborative project between public and private, with public and private funding. The byline of Optima is to tackle cancer through real-world data and artificial intelligence. So it's a very, very interesting topic. In the Public and Patient Advisory Board, we are asked to attend each of the annual meetings of the Optima Consortium. And there we listen to the progress and the plans for each of the workshops. And from time to time, the work pack leaders come to us and say, well, we have something that we are planning. It may have an implication for patients, and we'd like to discuss it with you. So this is great. We give our feedback. Sometimes we reach out to different work packs and say, actually, we think some of the things you are doing, we should be involved with you. And we've had a number of different meetings with individual work packs away from the annual events, and we talk about how they're gathering data, how they're making a decision tool to decide how information should be shared with people, and also the overall communication on the project. Of course, they'll do the industry communication themselves, but they'd like us to be involved in the patient organization communication. From my own perspective, I think we're very well received in the project. The leaders of the project brought us on board and have essentially given us authority to speak as required, as we feel needed, and that's fantastic to have that authority. It doesn't always work too well. We have had a case in the last over the last 2 years where the Optima has run patient surveys, and they initially ran the survey without consultation. It was for patients and clinicians in parallel, and the questions were really, really difficult to answer. And many of us reviewed the questions and we just had to give up. It wasn't possible to properly complete the survey. Then we engaged with them following the failure of that survey, I would say, and asked them to rethink it, restructure it, reorganize the questions, and relaunch it. And unfortunately, that only had limited success. So they're looking at their research priorities, and they're considering that they have results from a survey, when actually we would contradict what they have to say and say actually they need to do more work, because they don't correctly represent the patient view. And I should have mentioned at the beginning, The project actually covers lung, breast, and prostate. So on the patient advisory board, we have representatives from patient groups within Europe for the 3 cancer types. And I think that's a short version of what's going on. And I'm happy to take any questions at any stage if anyone has them.
Thank you very much, Seamus. So to summarize, you could say that from this experience, sometimes research and patients are speaking different languages, right?
That's exactly right. Yes, yes. And I think as people on advisory boards, that's exactly our role, to pull them back a little bit and say, really listen to us.
In the end, from this research, patients will benefit, right?
Yeah, yeah.
I think we have a Scott question.
Yeah. Do you hear me? Yes. Okay.
Yes.
Yeah.
No, it's very interesting. It's nice that you told the story you told, because I think that's a very common occurrence. I mean, how did it happen that you weren't aware? I mean, that the survey was happening, I guess is what I mean. How engaged are you in the day-to-day operations in that project? That's the question I would have.
Okay. So day-to-day is a very good term. I also have a full-time job. So everything I do is voluntary and usually in my own time. So it's very difficult to follow the day-to-day work of what's going on. As I mentioned earlier, we are invited to the annual meeting, and at the annual meetings, we understood that there was plans ahead to create a survey, but the survey would have come out before we were consulted. It was one of those cases that we didn't reach out and say, hey, talk to us beforehand. But yes, we've had some difficulty, and it's also a learning curve for us that maybe we need to be a little bit sharper and keep a closer eye on these things.
I would say actually it should be that you should be engaged more than once a year in what's going on in the project. Is what whenever I've seen any kind of failures in these projects, it's always because people are not having the opportunity to interact enough, right? So because my guess is the researchers probably would have been happy to have you survey, but they just hadn't thought of it,
Yeah, and Scott, it's not that the project isn't willing to have us engaged.
Yeah, exactly.
But the project has lots of professionals, lots of industry involved in it, and most of their meetings are between 9 and 5. So I can't attend all those meetings.
No, that's always a challenge in this kind of job.
Thanks a lot, Scott, for the question and for answer, Seamus. And actually with this, I will like us to move to our panel. So our panelists, we have...
Blackhead, just to say there's another hand from Yasmin.
Sorry, I did not see it, Yasmin.
Thank you. I just wanted to add to this conversation that indeed it can be tricky if there's not really a structure to the engagement of the patient advisory group, because indeed researchers do their research. Sometimes things move very fast and then sort of there is no engagement. So yeah, that's why we're thinking of bringing ambassadors to these compositions to make it happen in the end and to have a more regular interaction. But indeed, I understand the trickiness of that if there's no structure to that, yeah. But
thanks a lot. So now I would like to present to you our panelists. We have 4 panelists for today, and with the open discussion, we have here with us Scott Wagers. He is a medical doctor and is a strategic advisor to medical nonprofits, researchers, and biotech startups. He's focused on helping disease foundations and researchers achieve breakthroughs. He has worked on a wide range of disease areas in more than 60 consortium projects, including asthma, COPD, pulmonary fibrosis, and COVID-19. I will also present to you Doblijon Karimov. Probably I pronounced this name a bit French.
No problem.
He is a tuberculosis survivor from Tajikistan. He has become involved in the Stop TB partnership after getting TB himself.
Yeah.
He works in as a case manager and helping others with TB. He's also a member of a community advisory group at our project Unite for TB. This is an innovative project that is improving and speeding up treatment for TB. Another panelist we have on board is Claire Williams. She's our patient involvement and engagement professional at the ELF. She facilitates patient involvement in several EU projects, including Unite for TB and Optima. And last but not least, Catherine Wiley is Lungs Europe fundraising and stakeholder engagement person, and she projects manage our operational grant. So she will be telling you about what that is actually. So with that, I would like to open the floor to all of the questions, either by raising hand or typing them in the chat. And I would have a first question for Scott. If you could maybe give us a little bit of like a portrait for us, your experience with different EU projects in which you have been involved. You mentioned some topics, but also like give us a bit of insights of the patient involvement from your projects.
Can I show a slide very quickly?
Sure, of course.
I think it kind of encapsulates. Let me see. Zoom if I can figure out where the share is. Here we go. Some of you, this will look very familiar. This is from the, I think it was really the very first consortium project that I got engaged with was EPAP. What we did to engage patient stakeholders, get their perspective in the minds of the researchers, we had an asthma art contest. So we had, I think it was probably about 20 or 30 different submissions, and then the consortium members judged those submissions. This was the one that was selected, Marie Kutstra. And from what I understand, maybe Dominique, you know more, but she's gone on to become a strong patient advocate. She's obviously somebody with severe asthma. This is what it's like to have asthma. I wanted to show that slide just to kind of say this sort of set the tone for what our approach to involving patient stakeholders, because the value of that art contest wasn't that, I mean, most of the people in the consortia were clinicians and researchers. They kind of, and some of them were PhDs. They didn't really know what asthma was like, but it motivated people to get engaged and to do the hard parts of the project, because EPAP had a very big, strong vision, and the researchers stayed motivated. But at one point, things were going very slowly, and one of the, it was a father of a boy with severe asthma. You know, things were going slowly with the clinical study. He stood up and said, "Oh, you know, what's going on?" You know, get a wiggle on it in a very English term, and that was also very motivating. So to me, that's always been the power of it. And what we always strive to do, and Claire can attest to this, has been in the Dragon Project, is engage patients, stakeholders as partners. So as partners in the, and I'm a big, as you may know, fan of what I call collective intelligence, which means people working together in a way to come up with new ideas, new ways to solve problems. And I think the patient stakeholders, which Dominique will also recognize, actually have some great aspects. And the thing about the patient stakeholder is you're able to bring in disciplines that typically would not be there, because they have a reason to be there, but they may be an engineer, they may be a mathematician, and it's quite different, but they can come in with some incredible solutions. And that's sort of the tone. So what I would say is with UBIPRID, we did that. UBIPRID was one of the forerunners in patient engagement in EU projects, because that was, what, now almost 17 years ago, UBIPRID. But it's something that it always adds such a big extra dimension, and all of the funding agencies really value it. In fact, the EU has a thing called Responsible Research and Innovation, which is about ethics, but it's also about engaging citizens in a very participating way. So that's my stick on that. I don't know if there's anything else you wanted me to discuss, Vladka.
Yeah, maybe we could engage with others as well, and then have a like open discussion.
Mm-hmm.
So I would ask Toblijon, like, I know you are not native English speaker, same as me. So what was your experience in being part of EU projects as a non-EU English speaker, and as well, you know, like you are having quite a big role in advisory group for Unite for TB.
Hi again. First of all, I would like to thank organizers for this meeting, for giving me an opportunity to participate and share my experience. Honestly, when I was offered to become a member of the community advisory group in Unite for TB, I was afraid because my level of English was low. But I set myself the goal of being a member of the CAC and at the same time learn and improve my English. Despite being busy, I try to learn new words every day. As a person affected by TB, I worked that time as assistant project manager at Stop TB Partnership. As a request of ERS in August 2021 to speak in the ERS Congress, I sent a video about how my organization is helping people with TB during the COVID pandemic by providing digital solutions. I acted under the guidance of Claire Williams, Patient Involvement and Engagement Coordinator from ELF. And in December 2021, Claire invited me as someone with a personal experience of TB to become a member of Community Advisory Group for Unite for TB. And CAG members' role is to provide feedback and suggestion at all stages of project journey, from the design and planning stage to monitoring and policy implications. Participate in all activities and that involve communities and TB survivors, with all particular focus on clinical trials. Co-develop educational materials aimed at TB affected communities and future beneficiaries. Advise on implementation of the community engagement program at selected trial sites to ensure that the informed consent process is well understood by patients, including appropriate awareness of TB and TB clinical trials. Also assist in disseminating project finding and engage in advocacy around Unite for TB findings. So what I prepared, I talked to you.
Thanks a lot, Toblijon. Maybe then to move to Claire, who was as well working with you on Unite for TB, to give us a little bit of, or like 1 or 2 pro tips to bear in mind for patients coming from to be part of some of the engagement activities in the projects. Maybe you could share some thoughts.
I will. So yeah, I think probably the first thing to remember as a patient participant, that it might feel quite daunting when you first get involved, because a lot of people in the project will be clinicians, researchers, and you might feel that you haven't got very much to offer, but you are the one who has lived with your condition, so you are the expert in it. The other people in the consortium might have researched your condition, they might have studied it at medical school, been to lectures, they might have worked with patients with your condition, but nothing can be a substitute for lived experience. And you are going to be able to offer a perspective on your condition that the other people in the consortium might not have thought of or might not have considered. So I think the other thing to bear in mind, and I think, you know, Seamus touched on this in his talk, was that sometimes you might need to shout a little bit louder to make your voices heard. The other people in the project will want to hear from you. They're committed to patient engagement, and I've seen that in all of the EU projects I'm involved with. But sometimes there's tight deadlines, there's heavy workloads, and they might forget about involving the patient, or they're not sure how to. And one of the things that we do here at ELF is to help patients get involved and make sure that they are involved throughout the course of the project, so right from the start, and at the planning stage, and then in every aspect of the project that has any bearing on patients and the public. And ultimately, you will have the satisfaction of knowing that people with your condition will benefit from the work that you put in to make sure that the outcomes of the project will take patients' needs into consideration. So, yeah.
Great, thanks a lot, Claire. And last but not least, Catherine. And actually, we could have even started with Catherine, because Catherine is working with us as a fundraising person. So she writes proposals, and as well she works on an operational grant, which is very specific grant from EU to address the internal capacity of organizations. Same as you mentioned, Seamus, before, like you have your daily job, right? You cannot commit yourself. But if there is internal capacity in the organization, maybe that could change. So actually, some of the tasks could be run by some specific patient groups. So maybe, Catherine, you could share some advices from the stage of proposal writing, and as well if you want to share anything from running the operational grant, please. The floor is yours.
Yeah, sure. I think I'll start with the proposal writing, because it's something that we all do quite regularly, and I don't want to tell those of you who've done it lots what to do when you already know, but there's a few key tips I can help. The number one tip that I think is really important is that you make sure you read the call paper. If you're going to write an application for EU funding, you're going to write between 60 and 100 pages. And if you're writing an application for a call that's not really relevant to your project, well, that's an enormous waste of your time. And so really make sure that, to start with, once you've read the call paper, you know that your project and the call are aligned. And certainly don't try and fit your project into the call if it's not work that you really want to be doing, because you then have to deliver a lot of work against these projects. What's the budget? Just look at the budget that's allocated for the call and see how many grants will be made for that budget. And then if it's one that's a sort of a repeat call, what projects have been funded in that area in the past? How much did they deliver? So if you're going to get, 5 million, you're really looking at a lot of impact that the EU is going to want to see. Whereas if it's a really small call, maybe it's a shorter term, just discrete project. And I just think you need to ensure that your outputs are aligned to what's expected for the budget. Look at the key themes and the key objectives within the call paper. Look at keywords and make sure that you're incorporating those into your application writing. For sure, don't use too much technical language. I mean, you can expect that the people who are going to be reviewing your application to have some understanding, but they will probably have quite a broad experience. So anything that's too technical or too floral even can just make your application much harder to read. So write in plain English and make it really simple. And this way the people reading your application and judging whether or not it's one to fund will have an easy time marking it up, and let's make their job as easy as possible, because you're more likely to get successful from that. And you really want to upload early as well. I can tell you from personal experience that when you're uploading your documents, you want to make sure you have all of your annexes. Go back to the call paper, check that you're ticking all the boxes that the commission or the call papers asked you for. If you don't have the correct annexes, or you've missed out some technical information that they've requested, they simply won't read your application. And then you can't even get some feedback to tell you what you could improve for your project for next time. So I think that's yeah, also really key. And then if you're really lucky, you'll, well, not just really lucky, if your project's really great, which I'm sure that you're working on an amazing project, you'll receive a grant. And then you have a lot of work to do. So the first thing you then have to start doing is getting all your technical data together, and you'll have to work with your project manager from the commission to make sure that the budget is up to scratch. They may come back and ask you to clarify some things within your project proposal. And that itself can take quite a lot of work and a few rounds of correcting and going backwards and forwards between your project manager. And then, yeah, I mean, Black, I think in terms of delivery of the project, then you really want to jump into it straight away. With the operational grant, it's been fantastic, because it meant that immediately we could increase our capacity in Brussels. And it also is really a great opportunity for you to take a step back and make sure that strategically you're doing everything correctly. It forces you to write a lot of big documents around work plans and objectives that sometimes you might not do if you've got the funding from elsewhere. So yeah, it's a really great thing to have, but it does also create a lot more work. So I think just being aware of that as well can be quite helpful when you're planning your project and planning your staff behind it. I hope that's helpful. If you've got any questions, obviously do let me know.
Yeah, thanks a lot, Catherine. I mean, we have 2 minutes, and I would like to open the floor for all the questions. I see Lydia has one. So you can unmute yourself.
Hello. So I'm working in a small company in France, and before, when you introduced ELF, you were mentioning the project matchmaking, which I think is really, really interesting for small companies as mine, that we don't have the power as a big pharma to carry out big studies. And I would like to know, how can we actually go into this little point of project matchmaking? How can we contact you? How can we participate in this?
So I think maybe you saw my email. Definitely you can always contact me on an email, and then we see, like, also from other sites where we have some projects in planning, which kind of disease area that is, which kind of consortium that are. Usually we ask for patient engagements to match with another consortiums that are, for example, big research projects that are looking for patients, but they don't have access to them, similar like what the European Patient Forum is doing. So yeah, definitely your first contact could be towards me, and then we see how to bring this together whenever there is some kind of specific call for research, or even for health on another stream, and there is another kind of group developing around this call.
Great, thank you.
Dominique is next one, unless somebody has addition to my answer. Pippa.
No, all good.
I have an addition to what Catherine said and what Scott said is, I read a lot of research applications, and one of the things I found is, please have your application read by someone a bit more outside of the group applying, because I see very often lots of inconsistencies, or so it's good that someone else sort of has a final check on what's happening. And quite often we, as Scott said, It's not really our role as PAC, but because we're not researchers and we have a bit of a further away perspective, we can see these things. And it's very annoying if people need to read all these inconsistencies and it doesn't make your application stronger.
That's really excellent tip and absolutely advisable. We have one chat question from Maria. How could we apply for EU grant for a project? There is this EU portal. I shared the slides in the beginning, but maybe you missed it because you did not join at that time, where all the calls are published, upcoming, but also past calls. So you can check, like this could be your starting point for EU grants. And with this, actually, we came to the end of our webinar. It's 2.2, so 2 minutes after our time. I would like to thank all of our speakers to present their experiences in the projects. That was really, really useful. Thanks, of course, all of our panelists and all of the questions. The recording will be available soon, I think, at the EPAP live webinar, EPAP webpage. So yeah, with that, I would like to close this meeting and see you some other meeting, probably in some other consortium.